Okay, so red light therapy research interpretation. Okay, so what is red light therapy? It's low level light therapy, PMB, and low level light therapy, which I'm going to call these just light therapy for now. Light therapy are just two medical treatments that are increasing in their clinical importance as well as their notoriety. So, light therapy is unique in that the level of absorption, or you can call it penetration, at this wavelength, 600 to 1300 nanometers, through the skin is useful for promoting wound healing, tissue repair, and skin rejuvenation. It's important to note that these are atraumatic, in contrast to, like tattoo removals or hair removal surgery and things like that. The light therapy here bypasses these destructive steps by directly stimulating the regenerative process in the skin. The action mechanism of light therapy encompasses increased cellular proliferation, migration, and adhesion in the collagen. Some downsides or some adverse effects of these might be inflammation, pain, and well, it takes a very long time. If these, are not for you, just stop using it. But it's also important to note that it's not the type of light, but the wavelength and irradiance that are accountable for these effects. So you can use LED, fluorescent lamp, or polychromatic spectrum, doesn't matter. LED is gonna be the most common and generally just because it's more energy efficient. Note that this could actually be a disadvantage to use LED due to the LED's dot-shaped emission, which could narrow the bandwidth and the coverage. Okay, so the paper I choose to interpret is a controlled trial to determine the efficacy of red and near infrared light treatment in patient satisfaction, reduction of fine lines, wrinkles, skin roughness, and interdermal collagen density increase. So this paper, very, very, very reputable by PubMed Central. And the objective, obviously, is to investigate the safety and efficacy of red and near infrared light applications for dermatology. The method here is 136 patients, 23 controlled, separated into four different groups, just the two sets of light sources at the two ranges of wavelength. And they're going to do these treatments twice a week for 6 months. So from T0, which is treatment 0, to T30, treatment 30. And the measurements that are going to be taken are just ultrasonographs to show collagen density, computerized digital prolifery, and clinical photography. So basically just pictures. And well, no surprise here. The result is that the treated subjects experience significant improvement in skin complexion and skin feeling. So let's just break down these results to see, if these are credible. So the baseline subject. It's very applicable here because the majority of participants are actually female, and the age range is quite expansive from 27 to 79, the mean being 46. First layer of confidence is like late 30s to early 50s. Now, there are some participant exclusion criteria. None of these should apply to you, but I'm just going to read them out anyways. The exclusionary criteria were physical and psychological diseases that can cast doubt on, the participants' ability to consent. Also, another exclusionary criteria is any preliminary treatment of red light within the 6 months prior to the study, excluding any invasive cosmetic procedures such as Botox prior to the study. And unfortunately, if you have skin cancer, any acute skin diseases, you are excluded. Also, you can't be pregnant or, be prone to epileptic seizures. That would be a bad thing around these lights. Measurements, more with the measurements again here. These are just the dosage that are going to be applied to each participant, and the subject outcome assessment will just be asking the participants how they feel. Okay, let's look at some results. So the focus here are going to be away from graph A and B and focus more on graph C and D, just because graph A and B, like I said before, are just, subjective. We're asking the patients how they feel. So graph D is going to be on the roughness of the skin. And as you can see on the bottom right here, that the blue dots in the bottom right are going to be the control. And as you can see, as the treatment progresses from T0 to T30, we see that the skin roughness decreases significantly. Of course, there are some outliers up here. I shouldn't call them outliers now, but there are some folks up here that did not experience any gain, but also they didn't experience any detriment. So it's just a time sink loss. But for the general populace, for both RLT and ELT, saw significant decrease in their skin roughness. And then we move over to graph C, collagen intensity score, or CIS. We see that the baseline, the control of 0 here, and anyone that received treatment are regardless of what type of light saw a significant improvement. So what does this look like? These numbers, what do they mean? So using collagen ultrasonography scans, so on the right here we see a significant improvement in collagen density from T0, which is no treatments, to 30 treatments. The collagen levels are much more dense, and so the skin is much bouncier. What does this look like? This is just pictures. As you can see from 0 treatments, we see a lot of lines. You see a lot more, to lack of a better word, sag. And from after the 30 treatments, the lines are spread out and the skin is just a lot more bouncy. Now, all of these patients only saw 30 treatments, so the long-term follow-up is notable here. So there are 77 subjects that did follow up, 25 of which continued for an extended period, 18 for 45 treatments, and 7 for T60. So the T60 60 treatment participants all measured significant improvement in all sections, from skin feeling, skin complexion, to collagen levels, to roughness. This could be biased. There is definitely an improvement, but this could be biased because the people that saw improvement at T30 were the ones that volunteered to see to progress to T45 and T60. So these people already have a positive reaction to the light, and so they'll just have more of a positive reaction to the light. So take this with a grain of salt, but what this tells us is that definitely if you are seeing success, you're going to see even more success. So why light therapy? Especially over invasive procedures, it is non-invasive, minimal adverse effects. Like I said before, the pain, inflammation, just don't use it. It's flexible, as in you can just use it or not. So the cons are that unlike Botox or unlike a skin peel, this takes a very, very, very long time. Continuous treatments are necessary. The results are not going to be seen immediately, like the study said. It's over a 6 month period to see any kind of marginal results. Okay, so these are the references. The first is the paper that I used throughout the presentation here. The Cleveland Clinic one is more of exactly what I said, and these two. So a lot of people are worried about the adverse effects to your eyes, like prolonged exposures to eyes. But these papers will actually tell you that light therapy, especially low-level light therapy, are a very useful tool to actually treat a lot of eye diseases. The large wavelength of infrared light makes it so that it is kind of, I wouldn't say impossible, but it's kind of difficult to hurt your eyes by staring at them. Okay, so in the sea of infinite products, which one should you get? I'm going to remove and veto all of these full body red light therapy devices. With that, we get the range of $100 to $200 for all of these mask type things. And I removed the full body ones just because, the efficacy can change with how the person would use them. Like, if you're too far away, then it's just not efficacious at all. And if you're too close, it's just uncomfortable. And for the pricier ones, like the $300-$400 ones, it's just the size. Like, look at the size of this thing. You don't need that. So that brings us down to a lot of these mass ones. And with these mass ones, this Hoterac one is the highest reviewed with the higher scores, right? 200 to the baseline, like 1, 5, right? 4. And most of the, low rated reviews are due to shipping or, the processing errors, like power adapter broke after 2 months, things like that. So it's not really the efficacy of the product. And like I said before, it's not the source of light, but the wavelength. And it does say the correct wavelength on here. So, this is as good as any. And also, I've been tracking this product for quite a while. And this $120 price, right? And this saved 10%. I actually bought this at saved 30%. So this was a significant value upon all of the other products. So, like I said, if it's on sale and you don't buy it, the company is actually stealing from you. So I had to buy it.